All right, Dave, here we are.
Legacies aren't often talked about until the end.
When I first came to town, there was maybe 4 gastroenterologists.
In terms of building something from the ground up, few resumes stack up quite like Dr. Jeffrey Murray, who retired after 39 years with Sanford Health.
We were busy.
Meeting the needs of evolving healthcare demands dedication to recognizing the reality of the present
We're going to take a look again today.
and the possibilities of the future.
Dr. Murray has always been phenomenal at cutting edge and thinking about being 10 steps ahead, right? What do we got to do next?
That question of what's next has several answers.
Dr. Murray was a brilliant physician, is a brilliant physician. He never stops thinking, and his mind continues to go.
Sanford Health is helping to address a national shortage of gastroenterologists by launching the only GI fellowship in the Dakotas. Dr. Murray served as the program's first director.
It's actually fun, because you're watching somebody learn a procedure that you yourself can do, and you're teaching that individual to do it, knowing full well that in the future, they're going to be the ones taking care of patients and maybe even ostensibly teaching fellows themselves.
The program drew more than 400 applications in each of its first 2 years before welcoming its first 2 fellows in 2025. One of them was Dr. Deepan Panirselvam.
He's an amazing teacher. Gastroenterology has a wide variety of things to learn about. It's just a never-ending ball that keeps on giving a lot of information. And he did not overwhelm us in the beginning. He just gave us the right dose of what we want to know and the things that would excite, someone without overwhelming us. And that was such an amazing thing for him to do.
We're growing our own, and it just makes us stronger.
There's also the garden where this growth is happening. The Center for Digestive Health is equipped with a rare combination of GI clinical and procedure space, a significant win-win for patients and fellows, and the culmination of a long-time vision for Dr. Murray.
It gives you pause because you realize this is something you've been working on for a long time. It's now come to fruition, and now the work begins.
Above all, it's the work that stands the tallest.
All right, rock and roll.
He was very talented also endoscopically.
So let's go fishing.
He had what I would say gifted hands.
The rapport that he had with patients was amazing.
Hi! So you were sick.
He is someone that every patient wants to hang out with. The way he communicates with them.
I wasn't as popular in high school.
And everybody was excited to see him, even though they were getting colonoscopies, which nobody likes to do.
I almost backed out of this one because I thought,
Oh, I'm glad you're here. We all want the greater good for the patient. We want them to have not only a great experience, but a great outcome, which are not necessarily synonymous terms. I think we're on the same page.
Those experiences build relationships over time, like the ones Dr. Murray has with patients who weren't quite ready to let him off the hook.
They usually say something like, well, if I need my colonoscopy in 3 years, you'll come back and do that for me, right? And so it's kind of fun.
And the colleagues he helped along the way.
You give a man a fish and then you feed him for the day, but then you teach a man how to fish and then you feed him for life. So I told him, thank you for feeding me for life.
A sign of respect for a legacy built on providing the best possible care today and tomorrow.
That's what medicine is really about. It's about touching lives. It's about ushering people through their lives.
With Sanford Health News,
You won't believe how rewarding it is.
I'm Justin Wolf.